A child was brought by his mother because she is concerned about some changes in him. He had a decreased school grades and not performing well like before. When he sleeps, he snores and it's difficult to raise him up for school in the morning. On examination, he has a mildly enlarged tonsils and inflamed nose, mucosa or turbinates. What what to prescribe for him? So in the history, the mother is concerned about the changes in her child, in which she mentioned that he had a decreased school grades. Child has a decreased school grades, not performing well as before, and secondly, she noticed that he snores while sleeping, and because of that snoring, his sleep disturbs, and he difficult to raise him up for school in the morning. When we examine on examination, enlarged tonsils and inflamed nose, mucosa or turbinates. So these are the three things: snoring while sleeping, daytime sleepiness, hard to wake up, and a decline in academic performance. Examination, enlarged tonsils and nasal mucosa are inflamed. So the options are oral loratadine, nasal spray, which contains steroids. Third one is antibiotic. This is the recall question. So once we think on the diagnosis, this case could be the allergic rhinitis, or it could be adenotonsillar hypertrophy. So in the options, they have given the oral loratadine, which is not the correct answer, because this oral loratadine is antihistamine, which helps with allergic symptoms like sneezing, runny nose, but does not reduce nasal congestion significantly. So this oral loratadine we will not choose. Another option is antibiotics. That is also not the correct choice. So why not antibiotics? Because there is no sign of bacterial infection and there is no fever, purulent discharge or sinus tenderness. So there is no sign of any infection. So we will not choose antibiotics. Another option is nasal spray, which contains steroid. So the nasal steroids, mometasone or fluticasone, this is first line for the allergic rhinitis, which reduces nasal inflammation, congestion, and improves airflow, and can reduce snoring and improve sleep. So this is the best option. Nasal steroids spray. This is the correct answer. So another question: a picture of old woman with features of Bell's palsy, and the condition described presented in 24 hours, and asking about the treatment. So the options are antiviral and another is corticosteroids. So the Bell's palsy, which is acute lower motor neuron facial palsy, affecting the one side of the face with rapid onset hours 1 to 2 days after excluding the other causes, as here they have given the timing which is 24 hours, and in treatment antivirals are corticosteroids. The symptoms and the Bell's palsy, which includes forehead weakness, inability to close the eye, drooping mouth, altered taste, and hyperacusis. These are the features, and here they have given that Bell's palsy's feature and the condition described, and we have to treat and we have to choose the options. They have given here the two options, antiviral and corticosteroid. So whenever we treat the Bell's palsy, if the patient presented within 72 hours, then we have to go with the steroids. So as per Australian guidelines, antiviral alone are not useful. So this antiviral option is not the correct answer. But if in another option they have given that both together, like antiviral and steroids, and patient has presented with severity of symptoms, as there is a one classification for the severity of the Bell's palsy. There's a one grading system which is known as House Brakeman grading system. So in the guideline they have mentioned if there's a severity like in grade 5 and 6. In grade 5, this if the paralysis is, if severe dysfunction is there or total paralysis is there, then you can add the antivirals and steroids both together. But here in the options, as we can see that antivirals are separate, so and also patient has presented in 24 hours, so steroids is the correct answer. Steroids is the best option. Thank you very much.